The COVID-19 pandemic tested the world and put stress on all of our systems, making it necessary to quickly develop new solutions.
The U.S. Secretary of State Anthony Blinken announced the U.S. government's initial commitment to partner with India's Ministry of Health and Family Welfare, as well as state governments, to increase COVID-19 vaccination efforts across the country, especially for vulnerable and marginalized populations. USAID is committed to partnering with local organizations and shifting funding and decision-making power to the people, organizations, and institutions that are driving change in their own communities, making the results we foster more sustainable. USAID's Momentum Routine Immunization Transformation and Equity Project embodied USAID's commitment to localization by engaging 26 local organizations across 18 states in India.
The 26 diverse local organizations had prior experience of working for the betterment of communities. They had a deep understanding of the local context and an active presence in target geographies. More importantly, their vision for vulnerable and marginalized groups aligned with our project goals.
Together, USAID's Momentum Routine Immunization, Transformation and Equity Project and these local organizations engaged in planning, prioritization of supply chain logistics for equitable vaccine delivery, built the capacity of local health workforce, generated demand for vaccines, and monitored for vaccine safety.
John Snow India is the lead partner for the implementation of the program. The project has particular focus on reaching vulnerable populations like senior citizens, migrants, tribal populations, transgender people, people with comorbidities, and people with disabilities.
We may think globally, but we have to act locally. And in India and in countries around the world, we relied on the localization framework and the project's co-creation approach to light the way.
Advancing the well-being of vulnerable communities through partnerships with public and private sector and civil society to produce innovative, evidence-based and sustainable solutions has proved vital to ensure the success of this project.
Collaboration with diverse stakeholders formed an integral part of the project for reaching the masses and addressing vaccine hesitancy.
Since religion plays a significant role in our culture, the massive influence of the faith-based organization was leveraged in building confidence for vaccination.
The project reached out to local influencers who helped dispel misconceptions about the vaccine within their own communities.
NGOs tapped into local intelligence of the community and co-designed community-centric campaigns in local dialects to encourage vaccination. They reached difficult-to-access communities through interpersonal communication campaigns, customizing the national door-to-door vaccination campaign.
We identified volunteers from the villages and formed local partnerships with old age homes networks who had their finger on the local pulse. We collaborated with local expertise, for example, with the panchayat members and religious leaders, made Ashas and A&M the spokesperson for the campaign.
60 प्लस में जब देना था तो 60 प्लस की महिला या पुरुष कोई भी आना नहीं चाहते थे इस वैक्सीन को लेने के लिए, लेकिन घर घर जाके धूप में खटाखट दरवाजा को खटखटा के बुलाती थी कि भाई आइए भाई, आइए बाबा, आइए बहन जी, दादी जी, सभी को लगाइए वैक्सीन को, लेकिन फिर भी कोई नहीं मानते थे.
The NGOs also helped communities to bridge the digital divide to register beneficiaries on the government's COVID-19 vaccination platform, that is CoWIN. This allowed health workers to track vaccination status and identify pockets of the missed communities.
The project leveraged data analytics to mobilize resources and efforts towards low vaccine coverage areas.
Working closely with local bodies like panchayats and other government departments and local actors, the NGOs used available information to map dark zones like difficult terrains, tribal populations, where access to vaccination was challenging.
The project team hosted night camps for workers who were unavailable during the day. Special vaccination camps were also organized at workplaces to improve vaccination among the working population. The project employed innovative means of transportation to reach the last mile, such as mobile vaccination vans, ponies in hilly areas, camel carts in deserts, and boats in riverine belts. These helped transport vaccines and vaccinators to isolated settlements.
Through this project, we expanded our reach to 18 states and union territories, comprising 50% of districts in India which had COVID vaccination coverage below the national average.
Collectively, we reached over 56 million people with COVID-19 vaccine-related information and delivered over 15 million shots in arms.
Today, many organizations are using lessons learned to deliver routine immunization services. USAID's locally led development supports community-led institutions to lead the way, nurture sustainability, and prioritizes the perspectives and preferences of those we hope to serve.